Hi, everyone. I'm Steve. I'm here with Dr. Nario. Thanks for being here, Dr. Nario.
Hi, Steve. Thank you for having me. Always a pleasure.
All right, so we're going to talk about testosterone, which we like to talk about. And so we're going to talk about women and testosterone also, which is very important, and how to treat things and so on and get your hormones right.
Mhm.
First, Dr. Nario is at Biointegrative Health Center in Reno, Nevada. You can check them out online. And if you're interested in our weight loss program, use the QR code um, or the link in the description, and you can find out more about our weight loss program. So, the first question, I know the answer is women have if their testosterone is low, like a man, they have similar symptoms, right?
They do. So really, Steve, the common symptoms are what we call the non-specific symptoms, unfortunately. So when you talk about testosterone, it's related to fatigue, lowered libido, loss of muscle mass. So these are morely common, I guess, comments from these patients who experiences this. But
Women.
women, yes, but men too. These are the same. It's just that the thing there is usually how can you now differentiate this from other pathologies? Because of course, women, of course, or people just come to you thinking of one specific diagnosis because they probably Google that, they ask people about it, but our job as doctors, we need to make sure that, hey, is it really low testosterone or something else? And that's where, of course, the weeding gets a little deeper.
Okay, so you mentioned some of the common symptoms with men and women: low libido, lack of energy, brain fog. So, what are some of the differences as far as the symptoms that a woman might have that a man doesn't?
Right. Well, the thing here is, of course, we always think that testosterone is testosterone. They're all the same, right? Not really. It's actually comparing apples to a banana. It's not apples to apples. Why is that? For the reason that we know that men actually they have higher dependence on testosterone. So when you talk about baselines, men they have 10 to 20% higher baseline of testosterone versus women. So as you can see how much of a driver, if that's the gas that runs the car, it's not like a hybrid. Like for women, they only need a small amount of it. And when the fall happens, the majority of the effects really will be felt more by men. And the women, sure, they really it's maybe maybe a bonus for them to have testosterone, but it's really the prominent hormone of estrogen and progesterone plays a big role in their lives. But I'm not saying disregard testosterone. It's still the magic bullet. It gets into the mix. It helps out. So importance should be given to them as well.
So you're making this comparison. What high testosterone for a man is like 1200, and what's high for a woman? 40?
Well, that's a good question. So now this is where our usual blood test comes in. So in blood testing, a good example for you would be for men. We are happy with around what total testosterone of 500 uh, to 800, 900. For women, total testosterone would be around 70, 15 to 70, and the free testosterone, of course, lower, which is around 9, 10, 19. So it's really low. As you could see there, it's not even comparable to that 100 level of men to like the tenths of women.
So 1,000 total testosterone, 1,000 would be at the high, it's way high.
Oh, that's super
And
high for
and
for women.
70, would that be equivalent really high for a woman, or would it be 80?
Oh, so you're going over when you're hitting 70, but you always have to
Okay.
remember you're talking about total testosterone. Total testosterone is bound to a protein, meaning it's not active yet. They're just counting all the testosterone, regardless of it binding to a protein or not. The one that's important is free testosterone because this is unbound. This is something that has activity and can actually bind to receptors and produce results for you.
Right. Of course, the free testosterone is more important. I'm just trying to get a comparison to where like 1,000 is equal to 70.
Yeah,
Um,
yeah, yeah.
as far as, okay, as
Right.
far as high, so,
Yeah.
okay, oh, you're at the very top, outside the scale. Now, free testosterone, you said for a woman, is what, 15, 20 is pretty good. I
Well,
mean,
the free testosterone is when it depends on the measuring unit that you're using.
scale.
Picograms, yeah, like in the US and how we use it, it's 0.3 to 1.9, and picomoles is 3 to 19. So that's, I don't know if that's in Europe, but it's really more of picograms that we use here in the US.
Okay, so I know that you do treat women. I know you treat men. You treat me. You treat women. So, what are some of the obstacles, when they have low testosterone? How is it different than treating a man? Because I know there's a lot more moving parts, right? With all their hormones, it's a little more complicated, right?
Right. So with the low testosterone, really the thing that you have to remember that women actually is less dependent on it, as I mentioned to you a while ago, thus less damaging in terms of symptoms. But I'm not saying poo-poo that. It's just that when you see men, for example, a good example for you would be when men lose their testosterone, there's a higher risk of cardiovascular disease for these people. And then when you compare it to women, so it will happen, but not as drastic for the reason that estrogen is the one that will probably make that determination for women if they're really going to have cardiovascular disease or not. And because this is the more dominant role, for example, in protecting the blood vessels of women. And that's why that's a big difference. Another one would be fat distribution. So when low testosterone occurs, you would see that women actually will have the almost a distribution of men in terms of visceral fat. So because they tend to accumulate fat in their thighs, right, in their breasts and more of the lower extremities. But when, of course, low testosterone comes into the picture, now a belly fat will actually be something that's going to be related to that, and that also is a big predictor of cardiovascular illness. So again, you don't want your women to be growing bellies like men. That's basically the point there, and that's
That's
why,
kind of ugly.
right. So unless they're drinking a lot of beer kegs. But and that's my point, that estrogen is a big, I guess, buffer when the low testosterone comes into play. But again, this depends on now you're talking about premenopausal women, postmenopausal. It gets complicated on what stage of the cycle or the age group that women are in.
So, the low testosterone is a bigger risk for heart disease for men.
It is, but also for women, it can contribute, but not as bad as when their estrogen goes down. So it's like a little player in that big scene. Not as like when you're talking about testosterone for men, it's the major star of the show, and it's the cause of major problems eventually.
Okay, so what do you do when a woman's testosterone is too low?
So when testosterone is low, which is the more common presentation of women in the clinical practice, you basically need to put it up. So not super high, but the most common ways in how we do that would be bioidentical hormone replacement therapy. And of course, as I mentioned to you, you needed to weed through all the things before, because it's a controlled substance. You need to justify that it is the real deal. And that's why we have lab testing. So there's so many ways in doing that: salivary, urine, serum, take your pick. Integrative doctors, non-integrative doctors, they know what to do. So the methods and how we replace that would be creams or gel, topical, rubbing it on your skin, or we have injectables as well, the one that you stick. And of course, the pellets are out there also. The ones that I usually do with my patients would be more of the creams and gels, just because of how controlled that method of delivery is. And pellets and injections, they just bring everything so high. So I'm not against them. It's just that a patient should probably be using first the creams to see what dosage they should be in when they get into these higher forms of delivery systems. There are also oral, but I'm not a big fan of oral just because when you take it, it actually has a high, I guess, predisposition for forming clots. So that's something that I would probably, I mean, I don't even want to use that. But yeah, those are, I guess, conventional ways. So again, we can talk about the natural stuff, but these are the common conventional ways still in the integrative field that we're talking about.
So when their testosterone comes up, does it often affect other hormones that you need to address?
Right. So when we're talking about testosterone in men, we see this converting into estrogen. Same thing here. So when women, because it's all about body fat, right? Because the production of, you have to remember, estrogen is getting produced um, in specific distributions. 25% ovaries, adrenal glands, 25%. And the majority of women's testosterone actually is produced 50% from peripheral tissues, which is fat, fat tissue, skin, muscle, liver, and kidneys. So as women gets older, now the fat actually accumulates. No offense to the women, but that's becoming now the transporter or the factory that creates more estrogen. So it worsens their estrogen state when they're taking super high doses of testosterone. So that's why they always want to focus on testosterone that's just right and physiological.
And then hopefully the other hormones fall into balance.
Oh yeah, definitely yes. Because of course now if you're having high estrogen, now it lowers down progesterone. It affects DHEA and also pregnenolone and then cortisol. So all of these things are just bad chain reactions of bad stuff.
Right. Something goes too high, you got a mess.
Mm-hmm. They like it at the beginning, like I'm energized. Yes, I can like be an Iron Man, but I don't know about the long term effects of
Yeah.
having high testosterone.
Right. All right. So is there any questions that I didn't ask you, something that you would ask just to bring this to a close?
Yeah, so with testosterone, as I always say, now this is probably where my field comes in. What are the natural ways on lowering down testosterone, right?
You mean
So,
lower or raise it?
I'm sorry, raising. Well, we were talking about the. Let's talk about first the your first question when it's yeah, when it's low. Then I have some tips also how do you make it go high. So with low testosterone, how we can increase that naturally. So there, of course, exercise. The one that actually brings that up is high intensity interval training, or even resistance training. That's one of the bigger ones. And sleep. Definitely get that sleep around 7 to 9 hours to get that axis going with the hypothalamic pituitary gonadal axis. Stress, stay away from stress as much as possible. It's a bummer. It brings your testosterone down. And weight. So we have to eat right. Yeah, the right nutrition here, the right proteins, healthy fats, and carbs. And for supplements, definitely zinc, have that in hand, around 50 to 30 milligrams, magnesium, around 300 to 400 milligrams, vitamin D, famously around the most common 2,000 to 4,000 IUs, and of course, alcohol. So do not get over the limit of, for women, more than, I mean, one drink a day, for men, 2 drinks a day. And
That's a
specific,
lot.
yeah, well, again, that's the regular. I mean, that's a lot for us, right? But the regular intakers, this is really like very low. And then for other supplements, DHEA, of course, it's gonna convert into testosterone eventually. Fenugreek, this is an herb. Ashwagandha, that's another one. Tribulus. So there's a lot of them out there for increasing testosterone in the natural way. So, but to lower down testosterone, if you get in trouble with these high doses that you're taking, uh, we have spearmint tea. I like this. This is very non, I guess, harmful to the body. It's just so natural that I've used spearmint tea before. So what you do is you get like two two bags, tea bags of spearmint tea. You dip it there, and you just drink away and drain that spearmint bag over and over again, as it doesn't have any taste anymore, and it will actually help you lower down that testosterone if it's high. It's helpful for, I guess, women who has PCOS or polycystic ovarian syndrome. which these are pathologies that presents with high testosterone. And this is actually a very cheap way to lower that down. But you also have myoinositol to help that down. And of course, lose that weight.
Isn't it rare for someone to naturally have too high of testosterone?
In my experience, yeah, as I mentioned to you, one of the the common reasons why testosterone is high in women would be PCOS. So they always present with, of course, obesity. It comes with insulin resistance, almost diabetes like, but that's pathological. But when we're talking about a female who is just normal looking and maybe genetics actually had predisposed them to actually have higher testosterone, that is something that is common. Here's a clue for you. If the ones that are in the gym, who's always working out, who has this muscular physique, these are the ones actually probably naturally have a high testosterone, or they're constantly building up their testosterone naturally because of the consistent exercise. So a muscular physique is probably a good clue for you that this woman actually has high testosterone in a non-pathological way versus somebody who has PCOS.
Well, as always, doctor, we thank you for your input and your insight, and we'll see you next time.
RC, thank you so much. And as we all know, that our knowledge is your power to better health. And thank you for letting me provide you with edge on longevity and health maintenance, which I call the biological edge or the bio edge.